Hey, hey, I'm back. I tell you, I've got to be the queen of drama doing Facebook Lives. I want a thumbs up for that. So anyway, I'm back. So it's Sunday afternoon. It's 2:30 p.m. So it's time for Ask Dr. Lulu. While I was shooting it the last time, I guess my phone got overheated and we had to stop. I was trying to catch the sun in Atlanta, but the phone got overheated and we had to stop. Thanks, guys. Thanks, Rom. Rom, I'm just so proud of you. You've been watching me faithfully every Sunday. I love that. And of course, Elise, thank you so much. And Miss Quavi is in the building. So I am in Atlanta. I had to take a break and cool my phone down because that's reality, okay? But we're talking about gynecomastia. I love the loves. I love the hearts. I love them. Keep them coming. Okay, Kwabi, thank you. She says she sees me and she hears me. Awesome. So we're talking about gynecomastia, which is breast enlargement. Hi, Sumba. Breast enlargement in males. Okay, so I need you guys to call your friends. If you have anybody who has a teenage boy or who is a man, as a matter of fact, anybody who is a teenage boy, if you're a mother of a teen, if your neighbor is a teen, if you're going to be a teen, if you've been a teen, and you've ever wondered, I wonder why I had breasts when I was X age, you want to watch this video, okay? So I am a board-certified pediatrician if you're just meeting me for the first time. My name is Dr. Lulu. I'm a mother of 2 teenagers and 1 young adult, and I'm here every single Sunday talking to you about issues that affect teenagers. So in the spirit of October being Breast Cancer Awareness Month, because I bet you forgot that men can get breast cancer, right? We're going to talk about breast development in teenage boys, but more so in really all males. So grab a seat, get a drink, like me, hold on, bam, and let's get started. Awesome. So I just want you guys to know I cannot see your comments today. I'm not sure what's going on, but after that drama with my phone, I'm not taking any more chances. So I can't read your comments. Wait, I can. Okay. Hi, Sumba. Sumba said lovely. Good. So I can read your comments. So let's go. So the first thing is, what is the definition of gynecomastia? It's a big word for glandular development of breasts in males. In other words, men who have enlarged breast but has gland tissue in it. So it's very specific. It's not just enlarged breast from maybe fat. No, there's gotta be glandular tissue in it. Hi, Esther and C. Mac. Thank you so much for joining me. We're talking about enlargement of breasts in males. We're talking about breast period this entire month of October because it's Breast Cancer Awareness Month. So we're gonna be talking about breasts. We're gonna talk about men and just kind of get it out of the way. Then we can talk about girls next week. So, the definition of gynecomastia is glandular breast development in males. For the most part, in a teenager, in a newborn baby, or in an elderly male over the age of 60, it can be physiologic, which means it can be normal, which means it can be normal to have it. If you're a newborn baby, a male in your 60s up, or a teenager, it can be normal to have enlarged breasts. However, if you're a 4-year-old boy, if you're a 22-year-old boy, man, if you're a 36-year-old man, you have absolutely no business having breast enlargement outside of those three ages that I mentioned when you can have physiologic breast enlargement, okay? So it can be unilateral, in other words, one-sided. It can be bilateral, which is two-sided. It can be painful, or it can be without pain, okay? So again, if you're just joining me for the first time, we're talking about breast enlargement in males. It can be both sides. As a matter of fact, the reason I decided to talk about men and boys with breasts this time around was because my little man child, my baby son, said something about that the other day. He said, Mom, I don't know if this is normal, but I noticed that there's something going on with my breast. And then, of course, I explained to him, I said, it is quite normal because he's 14. So it's okay if you're 14 to have enlarged breasts, okay? But not outside of that. Then, so why do these boys just up and have breast enlargement at the age of 14? Because there's a mismatch in the hormone levels in estrogen and testosterone during puberty, there's a mismatch. There's kind of like an inequality, and the estrogens kind of win the fight at the beginning. Between the ages of about 11 and 14, the estrogens are winning, and so the breasts kind of starts developing. However, as a child gets older, towards 16, 17, 18, late puberty, those estrogens are overtaken by androgens or testosterone or male hormones, and then that breast usually recedes. So it is normal and physiologic to have breast tissue as a teenager. So if you're a teen boy, fear no more. You do not have cancer. However, most of my patients that come to see me, they just come for a physical or they come for something totally unrelated. And I'm doing the exam, I find it. Once in a while, they actually tell me about it, but most times I find it incidentally. They're like, yeah, I've always wanted to know, why do I have that? And so I reassure them. However, if the child is not a newborn baby, not a teenage boy, or not an elderly male, it is not normal to have breast enlargement. So those are called pathologic gynecomastia. We're going to talk about that now. Okay? So pathologic gynecomastia, many things have been kind of cited as causes of gynecomastia pathologically. The first one is your diet. A lot of people eat all kinds of crazy stuff these days, a lot of livestock, a lot of plants. We don't know what we're eating. Nobody knows who's getting what. And so a lot of times there are hormones being injected into these livestock. There are hormones being injected into these plants. And so we're getting a lot of those hormones, and so they're causing all kinds of drama in our bodies. So the diet will be number one. The second thing will be medication. There are lots of medicines out there that cause breast enlargement in males. The easy thing about that is if you know you're taking the medicine, you didn't have breast before that, and then suddenly you have breast, stop the medicine. Very simple. Okay? Just don't take it anymore. The bad one is the diseases. There are lots and lots of really bad diseases that can cause breast enlargement. Cause the number one is a tumor. Any tumor in your adrenals, any tumor in your testicles, any tumor in your body that produces androgens or testosterone can and probably will cause you to have enlarged breasts. So again, on a more serious note, hi BC, that's my girl. Hey girl. On a more serious note, if you ever, as a 4-year-old boy or as a 7-year-old boy or as a 27-year-old male or as a 40-year-old male discover breast tissue in your breast, please don't walk, run to the doctor. It's not a joke. It's very, very dangerous because it could be a tumor, right? It could be cancer. So you want to do something about it right away, okay? Other things that can cause breast enlargement is marijuana. Yes. All of y'all who are weed smokers, you think, oh, I'm just going to smoke it because it's nothing. It's not anything big. When you start having breasts, holla at your girl. That's one of the things that it can cause. Yes, weed use. Yes, marijuana use. One of the side effects is gynecomastia, amongst other things. Okay? We're going to talk about marijuana on its own one day because it affects teenagers. But right now, we're talking about how it affects teenagers and if it can cause breast enlargement or not. And the answer is yes. So be careful how you use it, okay? All right, then there are other things, other chronic diseases like liver cirrhosis, chronic liver disease, thyroid disease. Like who would have known, right? Hyperthyroidism or thyrotoxicosis can cause you to have enlarged breast men. So please be careful, okay? Again, I think the main thing is just if you're finding that you're having breast tissue outside of those 3 ages, you really need to run. Don't walk to your doctor, okay? So that's 2. And then there are lots of other syndromes, other genetic syndromes that can cause it. One of them is Klinefelter syndrome. Another one is Pearce-Jaggers syndrome. So Jaggers syndrome. All of those can cause abnormal hormone levels, and they can therefore cause abnormal things happening in your body, a male having breast tissue and things like that. So again, it is not a joke. I know when you see in a teenage boy, most times you think it may be, but you should not have the breast tissue present for more than 2, 3, at the most 2 years, maybe 3 years, and it should start getting smaller at least, if not go away completely. So if it's persisting, we have a problem. It's no longer physiologic. Okay, so the treatment, naturally, the easiest thing to say is if you're within the ages of 11 and 14 or 15, it is possible that it's purely puberty, it's purely physiologic. However, if it lasts longer than that age, if you're between the ages of newborn and 11, between the ages of 17 and 60, it is not normal. So I'm not going to reassure you, okay? And of course, some people get really, really emotionally affected by it. It causes a lot of psychological problems. So I say, if you notice that and you want to get counseling, you can. But if you can wait in a matter of months or maybe a couple of years, it should go away on its own. If it does not go away on its own, then we have a problem. Hi, Esther. Hi, Samantha. Hi, Coca Kingston. So if you're just joining us for the first time, we're talking about breast enlargement and gynecomastia in males, okay? Boys, teenage boys having breasts. What's that about, okay? So the treatment is, if you really, really, really are psychologically affected and emotionally affected by it, you can go ahead and take some medications. Most of the medicines will be anti-estrogen medications. I don't really encourage those. If it's purely physiologic, I just say wait it out. If it's pathologic, like if it's medication or your diet or like other things that we talked about today, then we need to take care of those. But if it's just physiologic, I say wait it out. But if it's really, really bothering you, then I can understand if you want to be on medication. Sure, talk to your doctor about it, okay? And then last but not least, there's surgery. Some people will have breast tissue and it's big enough to cause enough problem for them to want to have it surgically removed. I say again, talk with your doctor, talk with your counselor, talk with your parents, see if it's something that you would like, okay? Because every kind of surgery will leave scars. So be careful that you're not replacing one problem with another. I mean, I'm not gonna say don't do it if you feel like you need to have surgery, why not? Hi, Uju, that's my cousin. Hey, girl. So in summary, yes, teenage boys can and do often have breast enlargement. It is normal physiologically. Usually it's not too big. It's not big enough to have to, have surgery, have to wear a bra or anything. Every now and again, I say to myself, it's actually good for the men to feel it the way we feel it. So I say sometimes it's good for the teenagers to walk that walk so they see that it's not easy to have breasts, okay? It's not an easy thing. So in summary, it is physiologically normal to have breasts at newborn, especially if the mother is breastfeeding, as a teenage boy and as an elderly male. Some of the bad causes of breast enlargement will be weed smoking and some chronic diseases, some medications, and especially some tumors. So if you're noticing you're having a breast enlargement in that window, so outside of that window, please have your doctor check you out. And so I think that's all I have today. There's obesity. Okay, so there's been some drama about whether obesity causes breast enlargement or not. There's no study showing that it's really obesity that causes breast enlargement. I think it's basically just fat, excess fat. So it's not really obesity that causes that, so it's just man boobs. But there's some word out there about that as a cause of breast enlargement. But in summary, I think if your teenage boy, next time your teenage son or your teenage brother or your teenage cousin says something about that, just remember that Dr. Lulu told you that it is normal to some extent, depending on the age of the child, to have enlarged breasts. Now, that being said, girls, ladies, y'all, October is Breast Cancer Awareness Month. Everyone who is watching me right now, Uju, Esther, Sandy, Mandel, BC, Kwavi, Elise, anyone who's, that's Miss Schaefer. Anyone who's watching me right now, make sure you at least get your tatas checked this month, okay? Breast cancer is real. 1 out of 6 women is going to have breast cancer. It can kill. So please have your tatas checked and then holla at your girl, okay? And then because it's Breast Cancer Awareness Month, next week we're going to talk about breast exam in girls. We've talked about the boys, we're going to talk about the girls, and then we'll just kind of keep a breast theme going this month and see if I can pull it off, okay? So that's all I have for you guys. Let me see, what am I doing? I'm doing an interview this week with Pete Chat, I think. And then I have a couple of other fun things coming up. Please look at my website. It's www.teenalive.com. Subscribe to my newsletter and holla at your girl if you have any questions. I am not your doctor. I'll give you advice. And if you have any children who are going through depression or need to be coached, I'm a teen coach. I'm also a parent coach, so holla at your girl. And lastly, I'm trying to start my telemedicine practice going. So if you're one of those parents who might be needing a doctor to holla at you while you're at work, save you the trouble to go and pick up your kid from school and then not have a doctor's appointment, I am your man and I am your woman. Other than that, I'll see you guys next week. Thank you so much for joining me. It was fun as always. Peace.